discharge from the hospital, several criteria need to be met in order to ensure you will have the best possible chance of a successful recovery at home. Sometimes anesthesia can cause post-operative nausea and/or vomiting, so prior to discharge, we will ensure you are eating and drinking without difficulty. For patients who have had an anterior cervical surgery, expect to have some trouble swallowing, particularly in the first week. This is best managed by limiting your diet to liquids and soft foods until the swelling from surgery has improved. For patients who have surgery through the abdomen, we will ensure you are passing gas and/or have had a bowel movement prior to discharge. The medications we give you for pain post-operatively can cause significant constipation. Straining to have a bowel movement after surgery can be incredibly uncomfortable and increase post-operative pain and muscle spasm. To manage this, we recommend you take a stool softener daily while you continue on prescription pain medication. We will also ensure you are able to urinate normally after surgery, as anesthesia and/or the catheter used during surgery can cause some urinary retention. If admitted to the hospital, expect to have several bladder scans in the first few days after surgery. This is an ultrasound of your bladder, which is done before and after you urinate to ensure complete emptying. Prior to discharging home, we will need to ensure that your pain is adequately managed with conservative management techniques and oral pain medication. Please watch the pain management video for additional information. Finally, we will make sure that you are moving well enough to be safe at home and that you can manage your spinal precautions. Remember, you need to avoid bending, lifting, and twisting. You may work with physical and occupational therapists to ensure your mobility is sufficient for discharge home. You may need additional help and therapy intervention prior to discharging home. This could include home health therapies, a short stay in a skilled nursing facility, or a stay in acute rehab or a similar rehab facility. Your therapist will discuss your situation and make recommendations, and case management will work to facilitate the discharge plan that is safest for you. To summarize, prior to discharge, we will need to ensure you're eating, drinking, walking, urinating, and your pain is well controlled with oral medication prior to discharge from the hospital. Once you arrive home, it's important that you keep your incision clean, dry, and open to air. Do not use lotions, cream, ointments, or oils on or around your incision. Do not immerse or soak your incision until approved by your provider. This means no bathtub, hot spring, swimming pool, or sauna. You can expect to have your first follow-up visit 2 to 4 weeks after surgery. At this visit, we will evaluate your incision, discuss your pre- and post-operative symptoms, do a physical examination, and often place a referral for outpatient physical therapy. The bulk of your follow-up care will be provided by advanced practice providers, either physician assistants or nurse practitioners who directly communicate with your surgeon. Remember, the healing process takes time. Walking is the best exercise, and it is important to increase activity slowly so as not to worsen pain or increase anxiety. If you are feeling well, you can increase your activity a little more each day. You will be anxious to get back to being you, but overdoing your activity can actually prolong your recovery. Remember, back pain tends to bother you the day after you have overdone your activity. If you have a bad day, try to think about the day prior and what activity you may have done that was too much. As always, if you have questions or are concerned about your recovery, you can call our office at 970-298-3188 and speak with one of the providers about your specific situation.